papilloma is a benign neoplasm of the oral cavity arising from the epithelial tissue, characterized by an exophytic papillary growth with a typical cauliflower-like appearance. The etiology is usually due to HPV virus, human papilloma virus type 6 and 11, common in the 3rd, 4th, 5th decade and also young children. Both the sexes are affected. The sites are usually the tongue, lips, buccal mucosa, gingiva, hard palate and the soft palate. Now, the clinical features are usually it is a slow growing, exophytic, soft, and usually pedunculated, painless, well circumscribed, nodular growth with a cauliflower like appearance. Numerous finger like projections can be seen on the surface. It is an ovoid swelling with a rough or a corrugated surface. It is usually white, firm in consistency, and highly keratinized. There is an inverted type where there is inward growing, as usually seen in the lateral wall of the nose, paranasal sinuses, and maxillary antrum. It has a higher tendency for malignant transformation. Papillomatosis is multiple papilloma coalescing to form a large lesion. It is associated with skin diseases like focal derma hyperplasia syndrome, nevus unilateralis, Cowden syndrome, and acanthosis nigricans. Coming to the histological features, there is proliferating of the keratinized stratified squamous epithelium in the form of multiple finger-like projections. Hyperkeratosis and acanthosis can be seen. Every single finger-like projection has a fibrovascular connective tissue core which contains few inflammatory cells. Coliocytes are usually seen. These are the virus-altered epithelial clear cells with a small pycnotic dark nuclei surrounded by a clear halo, usually seen in the spinous cell layer. It has less cellular atypia as well. The differential diagnosis is verica vulgaricans, focal derma hyperplasia, verruciform xanthoma, and verrucous carcinoma. Treatment is conservative surgical excision. Here we can see the coliocytes, pycnotic nuclei surrounded by a clear halo. Then these are the fibrovascular connective tissue core in a finger-like projection. Multiple finger-like projection lined by keratinized stratified epithelium.